Good evening. I am Josiah Lyons, and this is my TED Talk. Imagine waking up in a neighborhood where the nearest grocery store is 20 minutes away, where the sidewalks are cracked and unsafe, and the air smells faintly of smoke and exhaust. Now imagine someone just a few miles away in a different neighborhood walk into a store stocked with fresh fruits and vegetables, with clean parks for their kids to play in, and top-rated hospitals nearby. It's not luck or personal failure that creates these differences. It is the reality of health disparities, a problem that affects millions of people every day. Health disparities are different, and health outcomes that are closely linked to social, economic, and environmental disadvantages. They show up in differences in life expectancy, chronic disease rates, infant mortality, and access to quality care. In some communities, people are more likely to suffer from preventable illnesses or die younger than others simply because of where they were born or the circumstances they were raised in. Understanding why these disparities exist is essential if we want to create meaningful change. The root cause are complex but deeply connected. One major factor is the social determinants of health. These include income, education, housing, access to nutritious food, transportation, and neighborhood safety. For example, someone living in a low-income neighborhood may have fewer opportunities for physical activity because parks are unsafe or non-existent. Grocery stores may be scarce, meaning families rely on convenience stores with processed food. Limited access to transportation can make it hard to get to the doctors or hospitals, even for critical appointments. Historical and structural factors also play a huge role. Policies and practices that have discriminated against certain groups, such as redlining, unequal school funding, and unequal access to jobs, continue to affect health outcomes today. Systemic racism shapes the conditions in which people live, work, learn, and grow, leading to higher rates of illness, stress, and mortality for marginalized communities. Environmental factors like exposure to air pollution, lead contamination, or unsafe streets add another layer of risk. When all of these factors intersect, they create a cycle that is extremely difficult to break. Access to healthcare is another key factor. Some communities face underfunded clinics, long wait times, and barriers to insurance coverage. Even when healthcare is technically available, mistrust of medical institutions, often rooted in historical abuses, can prevent people from seeking care. All of these conditions combined create gaps that are preventable but persist across generations. The good news is that there's interventions that can make a real difference. Increasing access to preventive care is essential. Mobile health clinics, telehealth programs, and community health centers have already improved outcomes in underserved areas. These services bring care directly to communities and reduce barriers like transportation and cost. Health education also plays a major role. Teaching nutrition, mental health awareness, and importance of exercise empowers people to make healthier choices even in challenging circumstances. Policy interventions are equally critical. Governments and city planners can invest in safe parks, reliable public transportation, and affordable housing, all of which indirectly improve health policies addressing income equality, such as fair wages and social safety nets, reduce stress, and improve access to resources. Improving education opportunities and ensuring equitable school funding also creates long-term benefits for health. Another important solution is building trust in the healthcare system. Culturally competent care and representation among healthcare providers can break down barriers. People are more likely to seek care when they feel understood and respected. Programs that include community health workers and peer educators help bridge gaps between formal healthcare systems and the people who need them most. Communities themselves also play a major role. Grassroots organizations and local initiatives have demonstrated powerful results. Programs like community gardens, exercise programs in schools, mentorship for youth, and local health fairs create immediate, tangible improvements. When communities have a voice in shaping health policies and programs, interventions are more effective and sustainable. We also have to consider the long-term benefits of reducing disparities. When health gaps shrink, lives are saved, families are strengthened, and communities flourish. Children who grow up with better access to care and healthier environments are more likely to succeed in school and avoid preventable illness. Adults are more productive and can contribute fully to society. Overall, society benefits not just morally but economically, as reducing disparities lowers healthcare costs and improves quality of life for everyone. Addressing health disparities is not easy. It requires collaboration across sectors, government, healthcare, education, business, and community organization. It requires listening to the people most affected and designing solutions with them, not for them. And it requires persistence because systemic change takes time, but the potential impact is enormous. Think about what it would mean if all communities had equitable access to healthy food, safe environments, and high quality healthcare. Imagine a country where life expectancy and disease rates were not determined by zip code or skin color. That vision is possible, but only if we commit to understanding the root causes, advocating for interventions, and implanting solutions at every level of society. Health disparities are not abstract statistics. They are reality of people's lives, of families, and neighbors struggling with preventable illnesses, stress, and barriers to care. But they are also preventable. Each intervention, each policy, and each community effort contributes to closing the gap. Reducing health disparities is not just about numbers. It is about giving people the chance to live full, healthy, and meaningful lives. So when we think about health, let us remember that it is more than personal choices. Health is shaped by the systems and structures around us, by history and opportunity, by policy and community. While the changes are real and complex, the solutions are within reach if we are willing to see them and act. Together, we can create a future where health is right, not a privilege, and where everyone has a chance to live. Thank you.